Hello everyone, and welcome to my channel, A Quest for Truth. Today I'm going to be talking about the over-medicalization of childbirth. And it's actually fitting because I'm actually recording this video on Mother's Day. So before I start that, I just wanted to kind of give you an overview of who I am and how I started this channel, and then I'll get right into the topic. So back in 2017, I'd been working at a nursing home about 4 hours from where I am right now. I'm back in my hometown now, but this was 4 hours away. And I had moved there 20 years prior with my husband, and we raised 3 kids there. And I worked a full-time, well, part-time when my children were young, and then a full-time job after that in nursing for 20 years. And we decided to separate in 2017, and that left me when I decided to move back home 4 hours away with quitting my nursing job at the nursing home. So I totally intended on, once I got settled, going back to nursing. And the more that I started to get settled and I realized, hey, I need a break. So my sister needed a nanny at the time. So I started being a live-in nanny for her. And in the meantime, I also started talking to an old friend of mine, which is now my husband, and he started waking me up to the lies and deception in this world. And having an open mind and being intrigued by what he's saying, I started looking into things myself. And a lot of the things that I was particularly interested in was the healthcare system. And I started to become unsettled by some of the things that I was starting to learn, particularly about this. Now, that was an issue because I had always had to give or get those, being in nursing. But I figured, there's probably a way around it, and I can probably still, find a job at a local nursing home. Well, then C-1, the rest, I can't say the rest, happened. And I didn't know what to think at first. And I was thinking, is this another deception? Is this another lie? What is this? And so I was very skeptical from the beginning. And the more I saw about inconsistencies, and the more I saw how, everything we knew about health, and optimizing our health and with like fresh air and sunshine and good nutrition and all that just seemed to go out the window. And there was just so many things to it that I couldn't. I said, that's it. Plus, I knew that there was one of these on the horizons for it, and I had already been adamant against that. So then I decided I would never go back, and I haven't, and my license is now, I don't have a license. It's over the time, and I would have to take a refresher and write the exam in order to be an RN again, and that's just not going to happen. So a few weeks ago, probably about 4 months ago now, I was in my car one day and I spontaneously just made a video, and it ended up being kind of a video to everyone, just kind of explaining how there's 2 different realities and the way that we're looking at the whole thing, and that people just needed to have open communication and start talking to each other. So I watched the video and I decided, hey, might as well just upload the video to YouTube and see what happens. So I did. And so I got a, fairly good response from it. So I decided, you know what? I'm just going to try this out. So, which leads us to now. So if you found this channel, you're, probably looking for truth. You're probably looking for, you're probably looking for different information than you've been fed. You're probably realizing that we've been fed a lot of falsehoods. And I can tell you that with truth, it takes a lot of digging and it takes a lot of connecting dots. So this current video that I'm doing is part of a 6-part series on Rockefeller medicine. So it's to do with childbirth. And just speaking to all you moms out there, you know, there's probably been a lot of different experiences with hospital births, natural births, but probably most of them have been the hospital setting. I just noticed lately more and more people are doing the midwife thing with the tub at home, and I think that's awesome. So I'm going to start by telling you my birth story about my first child, because it's going to segue into my point about the over-medicalization of healthcare, and it kind of segues into one of the pieces of evidence I'm going to put up. So in 1999, I was pregnant with my first child, and the pregnancy had been totally uneventful. And so I went in to have him at a hospital, and my husband was with me, but like most husbands, especially first baby, they're not much of a coach. And, naive me, before I went into labor with, I'm not going to need pain medicine. I'll just deal with the pain. Well, I ended up wanting an epidural, so that didn't work. And being overnight in a small hospital, they weren't going to call the anesthesiologist in for me. So that left me with Demerol. And Demerol didn't seem to work very well for me. I could still feel all the pain, but I was very nauseous. And when it came to pushing, I couldn't. I didn't have any sensation, and I just couldn't focus on the push. So being early on a Saturday morning, calling in the obstetrician to deliver me, he seemed like he was in a bit of a hurry. As to my knowledge, there was nothing wrong with baby. The heart did not, the heart rate was fine. But since I couldn't push, he decided to just go ahead and use forceps. Not the vacuum extractor, but the big salad tong. Well, I call them big salad tong forceps. And when he put those in, I don't know, these poor, women that have crowned know how intense that pain is. It's beyond. And I've had 2 children since, and I can tell you, wow. When he put those forceps in, it intensified the pain by 1,000. It was horrible. And I remember just looking into the ceiling and trying to get away from the pain and thinking, I need to crawl into the ceiling. I need to get away from what's going on here. And so that was over. I don't know how long that lasted, but it seemed like a lifetime. And the baby was born. And right here, there was quite a mark. It was quite a mark. And I remember my mother at the time, mentioning, hey, that was really close to his eye. And it was. So when I was doing my research the other day, I came across a video on, I don't know if she's an OBGYN or a midwife, but there's a video of her, and I think it's called the over-medicalization of childbirth. And this lady talks in there about that very thing, that there's so many interventions in the hospital setting. And if you start one often leads to another. For me, it was, I couldn't cope with the pain, so I needed the Demerol. Where if I would have had a coach, maybe I could have dealt with the pain, right? So I needed the Demerol. Well, then the Demerol made me so I couldn't push. So then the not being able to push led to the forceps delivery. So it kind of snowballed. So this lady is talking about that, and talking about, how if you're supported at home with a midwife, it's a natural process. And that many of these things that happen in the hospital, they jump the gun on. They jump the gun and bring in a medical intervention. And so she goes on to talk about that, how, if you just had the midwife at home with the tub, and, there's a lot of times they know exactly what to do in most situations, right? And more women are choosing to do this. But there's a lot of things other than, you can talk about childbirth itself in the hospital setting as opposed to the home setting. And there's that whole part of the labor process that, is totally different. At home, you're supported in water with a tub, with the warm water to help with the pain, hopefully not any pain medication. someone supportive to tell you how to breathe and whatever. In the hospital, you've got the bright lights, you've got a whole bunch of people in the room, you've got noise, it's sometimes cold feeling, and it's just not a setting that promotes a natural, healthy birth. So that's the labor part of it. The other part is that there's a lot of things that happen in the hospital that happen to baby once it's born that you really got to question. So when baby is born, and I'm going to support all my links with this. I'm going to put up links to support all of this information I'm giving you. So as you know, once the baby is born, it's attached to the umbilical cord, which is attached to the placenta, which has been attached to mom. And at the end of the birth, this placenta will detach and they'll cut the cord. That's one of the first things they'll do is clamp and cut the cord. So that duration from the time the baby comes out till they cut the cord is generally, I think they said, around a minute. However, many docs now are going with, well, and a lot of women, since they're doing their own research now, have decided that, hey, that's way too early. And so if you look at what happens when you cut that cord too early, there's a lot of things. There was a lot of benefits to leaving that, not cutting that cord so quickly. So what happens is if you cut that cord too early, you're going to prevent a lot of the blood that should have went to baby to going into baby. It's going to kind of just sit in the placenta. Now that blood that's in that placenta, and a lot of times it's 40% left behind that baby should have gotten, is full of stem cells. Blood in itself is full of oxygen, nutrients, and like I said, stem cells in this case with a newborn baby. So a lot of people believe that it's more beneficial to wait until that cord stops pulsating. But what do docs do? What do docs do in this? What have they been taught to do in this medical system? As soon as baby's out, cut the cord. Why? Wouldn't you think that they would have known better than that in the first place? Like, that's my question. How could they have not known that? How can they know so much and not know the benefits of that? And so there's the cutting the cord. And then for anyone that's been in the delivery room, they'll know there's a lot more that goes on. Vitamin K is usually injected right away as well. Now, vitamin K, for those that don't know, it's believed that the baby doesn't have the best clotting factors when it's born, and that's what the vitamin K is for. So, I mean, because they've gone through a traumatic experience of birth, right? Any baby's gone through that squeezing and all that the trauma that can happen. So I guess they figure that vitamin K is something that definitely they need. But if you listen to Dr. Suzanne Humphrires, and now she's someone I've already put up in my links in another video. She's she's got quite a few videos on this. And if you listen to her take on it, it's, she says, I don't know how she puts it, but she says nature has a way of providing these things. Like nature shouldn't have, she's she looks at it this way, and I look at it this way too. God, or nature, however you want to look at it, how would nature not provide a way naturally to take care of these clotting factors? Another thing they do at birth is put the erythromycin eye drops in their eyes. And a lot of doctors think it doesn't work. Now, the premise for this is that in case the mom has an STD, they don't get the infection in their eyes. But a lot of docs say that doesn't even work. And what does that blurriness do to the baby's eyes? It makes it so we can't see mom and bond properly. It does, and it irritates them. It would irritate me to have a bunch of goop in my eye the second that I'm supposed to be opening my eyes and looking around to see this world, right, that I just came into. So Dr. Suzanne Humphrires talks about the vitamin K issue as opposed to not giving vitamin K. And she mentions that, okay, for one thing, if you wouldn't cut the cord so early, that it would be beneficial because the stem cells, all of the stem cells would now be in baby. And anything that, any trauma that needed to be fixed or anything that needed to be healed, these stem cells should help look after, which also would decrease the need for the vitamin K. So there is another reason why one intervention leads to another one. Don't cut the cord so early. We might have a better effect with clotting and therefore not need the vitamin K. And so that leads me, and it should you, to think, why? How do they not know this? This is what gets me. How did they not know all this? Like, if they know enough to teach people the right way to do things in medical school, how did they not understand the benefits of leaving that cord? Don't cut that cord right at the time of birth, to leave it. And if a lot of docs are realizing about the erythromycin eye drops and that they're not working anyway, why are they still giving them? And vitamin K, I mean, it's like she explains, it's always with the minority that they seem to push a certain medical procedure. And with vitamin K, it's basically that's the case, because she said the very few percentage of kids that would have that traumatic birth, which maybe not cutting the cord so early would have helped, but the cord was cut early, maybe that would be beneficial and we wouldn't need the vitamin K in the first place. And so there's those 3 treatments that a baby is given when they're first born. But then here, where I'm living, there's also something else. And it's a hepatitis B given right at birth. And the child will need 2 subsequent ones, I think, at 2 and 4 months after that. So looking at that, why does the child need that? If you look at that, hepatitis B, there's no reason, really. They'll give you some kind of wacky reasons, but why would a child that age be susceptible to something that's either, it's either, an intravenous drug user or sexually transmitted, those kind of things. Like, why do we need to give that poor child coming out of the womb something like that? So if you look at the difference between natural and hospital, there's a lot of differences. And I think in order to understand this medical system, because this is what my 6-part series is on, is just to know a little bit about, hey, and to ask questions like, why? Why is it this way? Why, how do they not know that? That is a big question for me. How did all these scientists not know that, hey, it seems so simple to me when the midwives know it, leave it natural. More natural, the better. So that's really all I have to say on the matter. I think that, people look at birth a lot of different ways. And in the end, you got to do what makes you feel comfortable. And if I had it to do all over again, I would choose the home setting with a midwife. And, I just think that promotes the most nurturing and the best environment for mom to get to know baby. So I hope this video opened your eyes to some of the medical procedures and interventions that may sometimes be necessary and may most times not be necessary in the hospital with childbirth. And I just hope that opens your eyes to a little bit more, another piece of the puzzle as to this medical system, and should arise some questions. So next week, we'll be finishing up with the last video in this series. And I'm going to have to try to watch my words because it's about the big C, and I don't mean cancer. So stay tuned for that. Anyway, everybody, I hope you have a good rest of your day, and we'll talk soon. Bye-bye.